because I have to keep stopping. There we go. All right, I think Hannah's sorted out now. And I'm going to share my screen again. Okay, so these are the objectives for today. So let's get started. I want to ask all of you, how many types of arthritis do you think there are out there? Things change, right? They develop or they create or they discover new diseases and things like that. But as of right now, how many do you think there are? You can type in your answer in the chat, or you can just take yourself off of mute and shout out your answer. How many do you think there are?
I'm going to say 50.
Okay, yeah, good guess for sure. Anybody else want to guess? I found it really, when I was researching this, I thought, geez, how many can there be? I've been a nurse for so many years and I've seen different things for sure. But I really wasn't sure. I really wasn't sure as to how many types of arthritis there are. There are, in fact, over 100 different kinds of arthritis and related conditions. So they kind of clump in the related conditions if it has something to do with joints and issues like that. So I found that very, very interesting that there's that many. So when we think of arthritis, we know that arthritis is inflammation of the joints that can usually cause debilitating pain. So when you have inflammation in your joints, that can be from different diseases for sure. And we're going to kind of cover some of those, and then we're going to get into the relief part, which is the most important, I think. So did you know that in America, in the US, arthritis affects 50 million, more than 50 million adults? That's a lot. And not only adults, this is the part that really surprised me. 300,000 children in America are affected by arthritis. And who knew that? Do you remember when you were back in school, like in elementary school or just in school in general, do you remember ever even seeing or knowing of a friend or a classmate that had arthritis? I can't picture that. I knew there was this one boy that had some issues, but I didn't know what it was. But I certainly don't remember seeing a whole bunch of people with arthritis, because I think that in some ways it's invisible, or a child, maybe a classmate of yours in school didn't participate with running or doing some kind of like sports, but you didn't really know what was going on. That's why they call arthritis ageless. So just keep that in mind as we go through this, that there are a lot of younger people suffering with arthritis. The causes and treatment options available really do vary depending on what type of arthritis you have. So we're going to go through a few of the main arthritis types, so that you maybe you can see that this is something that resonates with you, that you have. Sharon, did you have a question or a comment?
Do the doctors treat all 100 variations differently? Are they aware of the different treatments for all 100, and do they do that?
Well, when I was doing my research, there are definitely some arthritis that are sort of clumped together and might have sort of similar causes of why that person has it. And you'll see when I go through a few of them. Now, because there's adults and there's children with arthritis, that might be a category, but it might be like, there might be, lupus in an adult and then lupus that shows up in a child, and it might be treated fairly similar, but it's counted as two because it's in different age groups. But yeah, you know what, Sharon, they're learning and researching and finding out about more and more things, and as they do, then they will pinpoint the causes and then therefore be able to come up with the treatments. But yeah, there are some out there that they don't know what to do. They don't know what to do, which is unfortunate, because if you're one of those people who has this sort of rare kind of thing going on, the doctors don't always know what the heck to do. So hopefully today's class will give you some ideas of relief, and some of us might not even, like some doctors haven't even diagnosed you, right? They don't know exactly what's going on. They just know you might be having joint pain. But I'm going to cover a couple of these things, and you'll see, and you might fall in that sort of category. as a nurse, I used to see all sorts of things. And yeah, I used to see quite a bit of stuff. So the very first one that's the most common is osteoarthritis. This one affects about 50 million adults in the 27 million adults in the United States. So if we've got like 50 million with the umbrella of arthritis, a good chunk, at least over half, are affected by osteoarthritis. So we call it OA for short. They like to have short names, so OA. And so with OA, this is what we call a degenerative type of arthritis. This is the most common. Degenerative meaning that the joint starts to just like get worse, progress, like it starts to, well, basically like the word degenerate. So with OA, you've got your bones here and you've got a cartilage around the bones. And so, you know, you might start off like this, but the wear and tear, so we call it wear and tear type of arthritis, before you know it, and if any of you have it, the bone is touching the bone. That is excruciating, that feeling, that rubbing of the bones next to each other. And this can happen really at any age, but usually it's after you have, you've been, you know, you're a grown person now, you've been walking or, you know, wear and tear on your joints for many years. My father, he's 88, he's got bone on both of his knees, and it's very painful. But so what happens is the bones are touching and it's causing the inflammation in here, and it's causing pain, and it's causing the bone injury almost. The bone is getting injured. Now your body is trying to heal you. So what it does is it forms what we call a callus almost, or a bone spur, and it causes this formation to try to protect the bone. But now you've got this little formation or something. Can you imagine if you have it on the bottom of your foot? You know, you're walking, it feels like you have a rock in your shoe, but it's actually a bone spur. So that's your body trying to protect you and heal you. So Sharon's mentioned here, she has what's called floating arthritis, as it seems to go from one joint to another. Okay, so I'm going to talk about a particular type of arthritis, and I'll talk about the particular name, and you've probably heard of it. Now, myself, I have not heard of floating arthritis. That might be the term your doctor used. No, oh, that's what you are calling. Okay, so you call it that. Okay, so I think that I know what it is that you have, and so we'll get to it. We're going to get to that pretty quick. So again, I use the picture with the knees because that's my problem. I have my left knee that the osteoarthritis showed up in after an injury, and you know, and I know my other knee's almost not as good. So like they're both the same almost. So I know that I had osteoarthritis in my family already. So let's look at the risk factors for osteoarthritis. Well, age, we know that once we're over 45, we are at higher risk of developing arthritis in general. So, you know, that is, that in itself is, you know, kind of sucks, right? Like as we get older, we're just at higher risk of getting arthritis. Obesity. So if you're carrying extra weight on your frame, that in itself with this type of arthritis is obviously going to put wear and tear on your joints, more so than somebody who is of, you know, managing their weight and they're not carrying the extra weight. Do you remember like when you go to if you ever go to the gym and you just lift up a 5-pound weight, how heavy that is? It actually feels quite heavy. Can you imagine like a 20-pound weight? That's massive. Like I actually do weights at the gym. And if I had a 20-pound weight in my hand, just trying to do one bicep curl or just carrying it around with me is heavy. So can you imagine if you're just 20 pounds overweight?